everybody in and nobody out. If you want health justice, let me hear you shout.
I'm John Swartz, the New Hampshire coordinator for Healthcare Now. We're a group of about 180 New Hampshire folk banded together to effect real healthcare reform. Nationally, we number about 54,000 people. In New Hampshire, we've joined forces with the Granite State chapter of the Physicians for a National Health Program. However, I've grown concerned that my country, my government, has been taken over by the very wealthy for their own agenda of ever-increasing wealth. I'm concerned that the people we send to Washington to represent us willingly succumb to the easy money and use their position as a stepping stone to the really big money as a lobbyist or consultant. That the interests of we the people run a distant second to those who supply large amounts of campaign cash. Concerned that our basic need of health care has been perverted to that of a profit center for corporations. Concerned that common, ordinary people suffer and some die simply because they won't be eligible to receive any health care at all. We are here today to record this video with a rap song donated to us by the rap artist Lonnie Ray Atkinson because we want to call attention to the solution to our current healthcare insanity. We want to replace the current Health Care Act with House Bill HR-676, the United States National Health Care Act. So, let's do it.
It's fiscally conservative to pay more for less. Is it morally conservative to accept the death that our system ensures when the insurance stops? Is it worse to be a scandal or a laughing stock? Ain't there one developed country wants what we got? They made the choice long ago to cover their whole lot. Left examples for us so we can follow they lead, but that's like godless talk for those who worship greed. Heresy to imagine people before profit. Good thing we've already baptized most of Congress. Sold out in 09 for the fake fix. A secret handshake with every corporate hand in the mix. As long as there's a dollar to be made, you can bet on a bill with more holes than some cheap fish nets. I said, here a hole, there a hole, everywhere a loophole. Here a hole, there a hole, just add to the bankroll. The politicians who let their constituents die, holding the loved ones' hands, saying they last goodbye. I'm talking thousands upon thousands every year. Tell me, is the profit model gonna dry they tears? The richest country in the world, Lord, what have we done? Still all you hear them hollering is we're number one, but we not, y'all. We not. But yo, it ain't too late for us to blow up the spot. So if you want health justice, let me hear you shout. Everybody in and nobody out. If you want health justice, let me hear you shout. Everybody in and nobody out. One plan, one nation, one nation, one plan. HR-676, y'all. HR-676. HR-676, yo, that's the bill we gon' cover each and every, but this time for real. Some say a single payer, some say Medicare for all, but as long as it's universal, it don't matter what you call it. No more pre-existing conditions, no more waiting through plan restrictions, no more networks keeping you from physicians, no holding on the line for a manager's decision, no more avoiding the doctor out of fear, and you won't lose your coverage if you change careers. No sweat needs charge from your hospital stay. I said no more deductibles, no co-pays, no first-rate premiums, third-rate plans, no medical bankruptcies ever again. But it's more than that, yo, it's more than that. A real step toward bringing our economy back and put us on the same footing as our global peers. The biggest job creator in the last 50 years, and now imagine recovering the billions lost to the excess profits and administrative costs. Not to mention the loot that providers would save when they ain't fighting with the insurance trying to get paid. We gon' bargain and negotiate the prices down till every drug lobbyist y'all hits the ground. And you can check the biggest box off a deficit list when the Medicare shortages cease to exist. But it's more than that, yo, it's more than that. This goes out to the loved ones we can't bring back. So if you want health justice, let me hear you shout. Everybody in and nobody out. If you want health justice, let me hear you shout. Everybody in and nobody out. One plan, one nation, one plan. HR-676, y'all. HR-676.
Let's do it.